the first thing I have to say about Botox is everyone is afraid of Botox, and there's so many anecdotal stories in the press about Botox toxicity. But I just recently saw a primary care patient who had 200 units of Botox used throughout their head and neck for migraine. And essentially, if you use Botox for what it's indicated for, the glabellar lines between the eyes, which after 20 years still has only a single application, are your squint lines, you're talking about maybe 20 to 28 units. People who use it in forehead lines and crow's feet then add more units. The drawback is that the more units you add, the greater the cost, and we still haven't found a way to increase the longevity of the Botox. Essentially, the more you use it, the faster you lose it. So if you're a big smiler, you're going to lose your crow's feet effect faster. If you're a squinter, you're going to lose your squint effect faster. And people who are pulling their brows up constantly are going to lose those forehead wrinkles faster. They also may not like Botox if it's put in too aggressively and allows the brow to come down rather than raise it up. And we have special techniques to actually raise the brow rather than bring it down. So Botox is a great product to prevent the wrinkling and to lessen the scrunching of the muscles around the eyes, particularly in the lower outer areas of the crow's feet, between the eyes for people who squint because they're light sensitive or have difficulty reading, high in the forehead for people who habitually raise their forehead out of facial expression or out of a need to pull their brow up, and then in very tiny amounts in unique cases around the mouth or jaw for people with downturned lips or people who purse really hard. If they sit there during my consults and the whole time they're talking to me, they've got this really hard lip purse going on, those are the people that should apply for Medicaid to pay for their Botox. But Botox is a great product. Its only limitation is the fact that it lasts only 3 to 4 months. It should be virtually painless. I've heard of people getting Botox and had to be held down to get their Botox. Using a slight topical anesthetic like we do and a 31 gauge diamond cut needle like we do, then 99% of people say, was that it? Are you done? They have absolutely no discomfort. Essentially all you do is hear a small crunch as the needle goes through the skin, but there's absolutely no pain. So if you're going somewhere and having painful Botox injections, something's being done that's just not as good as it could be.